Welcome, welcome. We are excited to have you here today. We'll get started at the top of the hour. In the meantime, if you are hearing my voice, please put your name and your organization into chat. Okay, we'll get started. I have us at the top of the hour. Welcome to the Nursing Home Quality Essentials session. This is a health equity session, and we will talk about health equity, literacy, and cultural sensitivity today. Next slide, please. I would like to introduce to you the Telligent team, our QI Connect Health Equity team. Belinda Rogers is a quality facilitator with Telligent. She has an expertise in health literacy, and myself today is presenting. And I am Tamika Williams, and I serve as our Senior Health Information Technology Advisor. Next slide, please. So let's jump right in. Health equity means that everyone has a fair and just opportunity to attain their highest level of health. Health equity, according to the Robert Wood Johnson Foundation, refers to the principle that everyone deserves a fair and just opportunity to be as healthy as possible. And so that involves addressing systematic and unjust differences in health outcomes that are rooted in social, economic, and environmental disadvantages. Health equity recognizes that health disparities exist due to such factors as race, income, education, where you live, and social determinants of health, or social drivers of health. Achieving health equity requires actively dismantling these barriers and addressing the root causes of health inequities to ensure that everyone has access to the resources and opportunities needed to attain their highest level of health. You can see on this image on the screen how health equity aims at addressing the unique differences of different populations. Equity is us being intentional. It's taking that extra step of fixing that sidewalk so that everyone can benefit. So the sidewalk fix is to make it wheelchair accessible, but everyone benefits from that intentional change. This visual, I got this visual from the Robert Wood Johnson Foundation. This is a really good visual that you can post around your nursing homes or your long-term care settings. And a chat to this visual is being placed. A link to this visual is being placed into the chat. Next slide, please. So the impact of social drivers of health on individuals and community is profound and far-reaching. 80% of an individual's health is tied to societal factors, where you live, work, or your job status, safe housing and transportation, and food insecurity issues. So things like, do you have access to a grocery store versus the corner liquor store really impacts the quality of health and wellness. Social drivers can contribute to health disparities, resulting in unequal access to healthcare services, resources, and opportunities. Disadvantaged populations, such as those affected by poverty, racism, or discrimination, often experience worse health outcomes compared to more privileged groups. Social drivers of health play a significant role in the development and management of chronic diseases such as diabetes, heart disease, and hypertension. Factors like socioeconomic status, access to nutritious foods, and exposure to health environmental toxins can impact an individual's risk of developing chronic diseases. Social drivers of health influence mental well-being by shaping the support systems and networks that individuals have access to. Social drivers of health are closely linked to life expectancy and overall mortality rates. So individuals living in disadvantaged communities or facing social economic hardships tend to have shorter life expectancies and higher mortality rates compared to those in more affluent or supportive environments. Social drivers of health affect interpersonal relationships and social connections as well. These are essential for emotional support, stress reduction, and overall just well-being. A strong social support networks can buffer the effects of stress and adversity, while social isolation and loneliness can have negative health consequences. Addressing social drivers of health requires a multifaceted approach that involves policy changes, community interventions, and individual level strategies. Next slide, please. So we often interpret things that are not really there. So a question I'm asking is, have you ever had a wrong first impression of someone? Has someone from a different background or another culture ever had a wrong first impression of you? So let's take a moment and look at this image for a few seconds on your screen. What do you see? And feel free to chat in what you're seeing. Like, are there gray dots? Do you see white or black dots? So now that you've looked at it, so this is an example of how we interpret things that really aren't there, right? And so have you, again, when you meet someone for the first time, what are some of the things that you really have thought and they're really not there? And so this was an example of just kind of seeing things differently. Next slide, please. So health literacy is a central focus of Healthy People 2030. Healthy People is a set of science-based 10-year national objectives for improving the health of Americans. It's published by the U.S. Department of Health and Human Services. And one of the initiative's overarching goals is to demonstrate the focus on eliminating health disparities, achieving health equity, and attaining health literacy to improve the health and well-being of all. So health literacy is what we're going to talk about today. Health literacy is the capacity to obtain, process, and understand basic health information and services needed to make appropriate decisions. Healthy People 2030 emphasizes the importance of clear, accessible health communication and education materials to improve health literacy. This includes efforts to ensure that health information is presented in plain language, culturally and linguistically appropriate formats, and tailored to the needs of diverse populations. Health literacy is also recognized as a component of cultural competency. At a residence level of health literacy can impact how and when they take their medications, their understanding of their health condition, and their attendance at their appointments and their choices regarding their treatment. Low health literacy has been linked to poor health outcomes, again, such as higher hospitalization rates and less frequent use of preventative services. Next slide, please. So let's look at how does Healthy People 2023 define health literacy? Healthy People 2023 define health literacy as the degree to which individuals have the capacity to obtain and process and understand basic health information and services needed to make those appropriate health decisions. They also break this definition out into two different focus areas. So personal health literacy, and that's the degree to which individuals have the ability to find, understand, and use the information and services to inform health-related decision making and action steps for themselves and others. And organization health literacy is a degree to which an organization makes that information equitable and enable individuals to find, understand, and use the information to inform their health-related decisions for themselves. Next slide, please. So what are the effects of low health literacy? It interferes with communication between provider and a resident. It affects the resident's ability to understand and follow treatment plans, including medication management. It lowers the resident's level of health knowledge and patient satisfactions. Residents with lower health literacy may not speak up when they have questions. They may not even understand what you're asking them to do, or they may be too embarrassed or lack the knowledge or confidence to tell you. Health literacy can impact a safe discharge plan for a resident returning home independently when medications or with medications and post-discharge instructions. When people do not understand their health condition or do not understand their treatment plan, they don't follow directions well. And again, this is especially true for medication management and can lead to patients becoming labeled as non-compliant. So their intentions, your residents' intentions may be good, but their follow through may be poor. Next slide, please. The American Medical Association Foundation has compiled 7 steps to improve interpersonal communication with patients with low health literacy. So I'm going to just go down the list. So 1 is to slow down. Sometimes a little extra time is needed so the resident can process the information better. Number 2 is use plain non-medical terms. So this is like you can use terms like high blood pressure instead of hypertension, or skin doctor instead of dermatologist. We all know that sometimes medical jargon gets kind of complicated for people to understand. So being mindful of that really helps. Show or draw pictures. So visual imagery can improve the resident's recall of ideas. Visual imagery can contribute to their cognitive stimulation as well. Limit the amount of information and repeat it, right? And so sometimes it's overwhelming for a resident to receive too much information all at once. Use the teach-back method. So the teach-back method is an excellent way to confirm that the resident or patient understands by asking them to repeat back your instructions. It may be helpful to say something like, I want to make sure I told you everything correctly. Can you please tell me what you're going to do to take care of your foot? Something as super simple as that can make the world of a difference. Create a shame-free atmosphere that encourages questions. Make residents feel comfortable asking questions. Let's normalize the act of asking questions by emphasizing that everyone has a question at times. And asking for clarification or more information is a natural part of the learning process. And lastly, be positive and empowering. Encouraging questions from the residents at every main point, offer ongoing support and encouragement, recognize and celebrate your residents' accomplishment, no matter how small. Acknowledge their strengths, talents, and contributions, and provide positive reinforcement to boost their self-esteem and a sense of worth. Next slide, please. I really thought it was important today during our time together to share some concrete situational examples. About 1 out of 10 people in the United States has hearing loss. Half of the people with hearing loss are older adults. So how can you communicate with a resident who is hard of hearing? For residents who are hard of hearing, check to see if they are listening when you begin talking. Every person is unique. Always consider their individual beliefs, needs, and concerns. Adjust your communication to ensure that the resident is able to hear you by talking slower. Do not assume that when a resident who is hard of hearing nods that their head nods their head in acknowledgement that they have actually heard or understood you. It's important to use open-ended questions to make sure that the resident has understood. Individuals who are hard of hearing have a harder time hearing when they are tired or ill. So remember that. Make sure that you have residents' attention before speaking. So maybe tap on the resident's shoulder, wave, or flick a light, or use another visual signal to cue their attention. You may want to sit closer to the resident. This will improve their ability to see if they rely on lip reading. It also helps with the voice levels and minimizes the effects of distant sounds. Be sure to speak clearly using your regular voice and lip movement. Maintain eye contact when you speak. If you have to turn your head, and avoid turning your head because that will obscure the view of your face. So people that tend to read lips need to see your face. Avoid standing in front of a light or a window. Position yourself so that the light is shining on the patient. Overhead lighting limits shadows. When speaking to the resident, don't place things such as pencils, gum, or food in your mouth. Another important thing, if it's safe to do so, remove your face mask before speaking. One thing to be aware of is that mustaches can create difficulty when people are trying to lip read. Also, taking notes or writing in the chart while talking with your patients who are hard of hearing can block, again, the view of your face. For patients who are hard of hearing, ask if you can close their door to eliminate the background noises in the area. Be aware of equipment noises in the room, in the hallways when possible. Find a quiet place to speak to the resident. A small whiteboard may ease communication. Be sure the resident is provided with the proper writing tools if needed. And then lastly, request an assistive listening device to help your resident hear. And again, I can't stress this enough, always have written communication, written materials to reinforce the verbal information that you shared with the resident. Next slide, please. So individuals living in poverty face a multitude of unique challenges. So when it comes to assessing and understanding health information, these challenges stem from various factors related to socioeconomic status, education level, living conditions, and access to resources in general. So show you believe they have potential. If you don't believe they have potential, they might not trust you or believe what you have to say either. People who live in poverty more commonly come from an oral culture tradition. Keep this in mind with materials you may have to give them. Talk with them about the materials you give them. Make sure they understand through a feedback loop or by paraphrasing or restating and asking clarifying questions. Build trust and help them see you as just another person instead of the voice or face of an organization or institution. People are motivated by what they feel is possible for them. So when there's a program or resource that you can help someone, find out what motivates that person and help them see how that program or resource can get them where they need to go. Addressing health literacy with people surviving poverty will take a multifaceted approach, and keeping these tips on this slide in mind can help bridge that gap. Next slide, please. So now we're on to cultural competency. So cultural competency is defined as the ability of providers and organizations to effectively deliver healthcare services that meet the social, cultural, and linguistic needs of patients and residents. Culturally competent care means delivering effective, quality care to residents who have a diverse beliefs, attitudes, values, and behavior. The previous slides may have addressed this nugget before. We should not avoid making assumptions about residents and what they prefer. Just ask them. If you don't know, ask. In addition, be open to new information and educate yourself about other cultures and build trust and connection with your residents. Be conscious of your body language, which can convey as much or more than words that you are saying. Most importantly, listen to your residents. Next slide, please. Next slide, please. One before that. The slide before that, James. It's the increased cultural competency slide. Okay, it looks like we're having some technical issues. Can you, it's the one right before that. There you go. Okay. So increasing cultural competency in nursing home settings is crucial for providing high quality, person-centered care to residents from diverse cultural backgrounds. Here are some effective strategies on the screen to enhance cultural competency. Increase cultural competency training. Make cultural competency training a part of the orientation for all employees. Ensure all clinical staff are receiving that training as well. Include training on the following competency areas: language services, family, community interactions, religious beliefs, languages spoken by residents, diverse health beliefs held by the patient population or resident population. Continually assess the training to gauge success and identify opportunities for improvement. Eliminate healthcare disparities, implement the national call to action, and increase diversity at the leadership and governance level, and communicate across the organization. By implementing these strategies, nursing homes can create a more culturally competent environment that respects and values the cultural competency on diversity of residents and promotes equitable, person-centered care for all. Next slide, please. So, what can you do to become a more culturally competent organization? Telligent advises the National Culturally and Linguistically Appropriate Services. So that's class. We we um we pro- we support you using the class standards. And the class standards were created by the Office of Minority Health, and they were created to guide our efforts to help us become more culturally competent. So those standards and a link to those class standards is being placed into chat. These standards are a set of 15 standards, and they are a set of action items that serve as a guide to help you advance and sustain culturally and linguistically appropriate services within your organization. So we have that first principle standard, which is an ongoing commitment to equitable, effective care. So that principle standard is all about providing effective, equitable care and understanding and respectful of the quality of care and services that are responsive to diverse cultural beliefs. So if you have that first standard, right, that first principle standard, there are standards 2 through 15 will give you that foundation to meet that first standard. And so the second standard is governance, leadership, and workforce, right? And so that area has um, two through four standards. And that governance, leadership, and workforce, that's mostly about recruiting and promoting and support culturally and linguistically diverse workforce. And that workforce that serves or mimics the population that you service in that area. The third standard is communication and language assistance. So communication and language assistance is more about offering communication and language assistance to individuals who have limited English proficiency or other communication needs, and offering those resources at no cost to them. And this is just to facilitate a better access to care for all. And then that last area is more of engagement and continuous improvement and accountability. So it's establishing that culturally and linguistic appropriate goals, policies, and management, and infuse them throughout the organization and planning. So overall, investing in cultural competency offers numerous benefits for nursing homes, including improved quality of care, enhanced communication, increased resident satisfaction, and reduced health disparities. By prioritizing cultural competency as a core value and integrating it into all aspects of the care delivery, nursing homes can create a more inclusive, equitable, and supportive environment for residents and staff alike. Next slide, please. And thank you for listening. If are there any questions in the chat?
None at the moment.
Okay. Well, thank you all for listening.